Thank you, Fred. Well, maybe you're not so pleased with certain areas of your body and you think, how about a little liposuction and suck some of that fat out? Well, we're going to find out today if that really will work and if it's right for you with Dr. Jason Leedy, who's a plastic surgeon. I always think of liposuction as it's just going to suck the fat out and get rid of cellulite. What really does liposuction do?
Well, it does that. It does remove the extra fat that's there. But you mentioned cellulite, and it's just not a treatment for that. Cellulite's that superficial fat that causes dimpling in the skin. And unfortunately, there's no good treatment option for that. But liposuction is good for that deeper fat that creates unsightly contours. It's good for people that are not, it's not good for people that are overweight. It's not a weight loss type of procedure, but it's good for people that are near their goal weight that just have isolated fatty areas, and it removes that deeper fat that creates the unsightly contours.
Would it be for somebody who is a certain number of pounds overweight, or do you not do it by pounds?
Somewhere around 20 pounds.
Okay.
You know, if they're within 20 pounds of their goal weight or ideal weight, then liposuction is a very good treatment option. But if they're heavier than that, then it may be best for them to try to lose some weight, because again, this is not a weight loss procedure. It's just good for targeted areas. And for that, maybe best they try to lose a little weight and then come back when they're ready.
And areas that they're having trouble with, where they're just like, I just can't get those extra pounds off.
Right. The area that they inherited from mom or dad.
Yeah, why does that happen? Why is it that you work really hard, you lose a lot of weight, but there are certain areas where you think, no matter what I do, no matter what I eat, no matter how hard I work out or how many crunches or squats, I just can't get rid of it?
It's just how we're built. It's just, we're all shaped a certain way, and sometimes, there are areas that are refractory to diet and exercise. And those typically occur in the hip area, the thigh area, sometimes under the chin, the belly, the love handles for men.
Okay, well, let's take a look at some pictures just to show what liposuction can actually do for someone. This would probably be a very common area, right? Around the behind area?
Yeah, that's right. A typical patient. She has areas in the outer inner thighs that, despite diet and exercise, just won't go away. She always had them. And liposuction helps to remove that area this is not an office-based procedure. This is done in the operating room. These areas are too large to treat with smart lipo, which can be done in the office. But
that's a big difference, though, in the picture we were looking at before. Is that just after one liposuction treatment?
That's one treatment. This is a surgical procedure done in the operating room, and she had approximately 3,000 cc's of fat removed, and it leads to a significant permanent change. It removes those excess areas and allows her to have the shape she always wanted.
Is there a way to show a patient ahead of time what the difference is going to be, sort of like, through a computer or?
There are different modeling things, but I don't use that. I typically just show before and afters in the office. And this is another typical type of patient, fatty excess outer inner thigh. She finished having children despite diet and exercise, just couldn't get rid of them, and liposuction creates a nice permanent improvement.
Yeah.
And this patient, not quite as much fatty excess, but she just didn't like the shape. And so liposuction is great for sculpting the body in the process of removing that extra fat. And here she is seen afterwards. And it just allows people to achieve that look that they've been desiring, and in the process changes how they feel about themselves. Liposuction is not always just for the hips and thighs. This patient had some excess in the chin, and a little liposuction under the chin removes that fatty excess, makes a dramatic change in the way that person looks and how they feel.
What about scarring? Is it very minimal?
It is minimal, because we're using 5 millimeter or so smaller cannulas to do the procedure, so the incisions are on the order of millimeters, and usually tucked away in inconspicuous spots in the natural creases of the body.
You mentioned one of the pictures, the woman had her children, which I would imagine that's very common. You would suggest doing it after you've decided to have all of your kids in order to try to keep that off?
Well, the best thing to do is to do it when your body is at its baseline, when you don't expect any major fluctuations. So certainly, if a child is down the road, or more often than not, that if people are planning on losing weight, they should do it after they've lost the weight.
Okay, and there are there different types of liposuction?
There are. There's the ones I just showed here are traditional liposuction. There's also ultrasonic. There is water jet. There is tumescent, but basically that's traditional. And then there's laser liposuction, all of which have different advantages, disadvantages. Traditional liposuction, though, by and large, will treat just about any problem that's there.
Well, if you're interested in learning any more about liposuction or the different kinds, you can contact Dr. Jason Leedy. He's with the Cleveland Plastic Surgery Institute. The phone number is 440-461-6100, or you can log on to drleedy.com. Of course, we'll also put that on goodcompanyshow.com. All right, thanks so much.
Thanks for having
Dr.
me.
Leedy, good to have you back.
Thanks.
Stay with us. We will be right back with more of Good Company. We're going...